Welcome to Sick of Sick Care, the Wellness Reframe, where we ditch symptom chasing, question the status quo, and finally start getting real answers about what's going on in our bodies. I'm Tess, registered nurse turned functional wellness practitioner, herbalist, and lover of both science and sage. I help people like you bridge the gap between standard healthcare and functional integrative healing so that you can feel like yourself again. Today, we're kicking things off with a big question. Are you sick of sick care? And if so, what can you actually do about it? What is sick care anyway? Let's talk about it. Because if you've ever walked out of a doctor's office feeling dismissed, confused, or like you just must be imagining your symptoms, you're not alone. Sick care is what the current model in healthcare is referred to by many: reactive, rushed, and centered around disease management rather than, true prevention or wellness, or even adequately addressing the main complaint in the first place. So it's a system that's brilliant at treating acute emergencies. It really is, no doubt. Medical advancement has come a real long way, but it's not so great at preventing or even managing chronic illness, I have found. It's not there to help you thrive and experience optimal health. Let's go with fatigue, brain fog, weight changes, anxiety, weird symptoms you can't explain. And what do you hear? Lab work looks normal. Everything looks fine. It's probably just stress. You're getting older. Try losing some weight or getting more sleep. And then it ends there, right? Like there's no, well, how do I do that? Where do I go from here? It's not always that our doctors don't care, okay? It's that the system they're working in isn't built to look deeper. It's not designed to ask why something is happening. It's designed to diagnose and then treat with pharmaceuticals. Many times, those pharmaceuticals are just adding to our long list of symptoms or even adding to other complications that need to be addressed. And it's a model that's no longer working for us. What's the alternative? Let's talk about that, because if this is what we have, what can we do? Here's the thing that's exciting, because there is a better way, and it's a whole person approach, and everybody knows that, but it's implementing it, right? Our system we just can't do it with the current system that we have. It just isn't designed to hold this concept. I mean, think about it. Standard medicine has a specialist for every system of the body. People are sent to separate doctors for a list of complaints. Oh, that belongs over in cardiology. That's neurology's problem. Go see endocrinology. I wrote the referral for you. Nobody's talking to anybody else, though. Like there's all of these, separate doctors and nobody's communicating. And then it really leaves the patient very confused, and they don't understand what's going on in their body in the first place. And then to have all of these separate people giving them information is just not cohesive, right? Until the person lands in the hospital in a crisis, and then they're eyeballed in the room by all the doctors. They're around the patient at the bedside to discuss the case and grand rounds. And then there's discussion of insurance driving the bus. Now, don't even get me started down that rabbit hole, but folks are seeing several doctors for the same set of complaints, taking the time to see them all separately, and then having to pay for each one, whether it be copay or out of pocket, etc., whatever that may be. There are people, especially our elderly population, who are seeing doctors. They're seeing doctors the most, typically, and they can't afford their copays with their fixed incomes with a lot of folks. So there's the cost efficiency as well. But I digress. Look, you're going to hear me say this a lot. Everything touches everything. The body is not a set of systems that work independently from the other. The systems work cohesively to support each other, always striving for balance and homeostasis in the body. You see, our body, it really is always trying to do the right thing for us. It's always working for us. It's sometimes hard to believe because we feel like my body's attacking me, but really it's doing its job. to fix an imbalance somewhere in there. So, with holistic and functional and integrative health models, deeper questions get asked. We want to know all the things because it all matters. Everything touches everything. These models consider your full story, not just your symptoms, but your sleep, your nutrition, your stress levels, your hormones, your gut, your digestion. What does that feel like? Your environment, including your relationships and childhood experiences. Everything that makes you, you makes up your health and what's going on in your body. In addition, providing education on how your body operates and how it works for you can help you become your own health detective and not just chase your symptoms. Only you know how you truly feel, right? But hearing everything looks fine can feel very dismissive when you know you're feeling something. So it's really time to change the narrative and dig deeper to uncover healing opportunities that aren't necessarily going to show up on paper. That brings me to the term root cause. Functional practitioners use this term quite a bit, including myself. But really, a root cause can be so far upstream, paddling back can seem simply impossible. It's really about delayering, if you will, every healing opportunity that can be uncovered to eventually bring that balance and that homeostasis back to the body and then build resilience, so that we can have stronger immune systems and better, just optimal health, really start to thrive. So instead of saying, how can we treat this disease? We need to start asking ourselves, what's out of balance in the body and how can we restore that function? Now, don't get me wrong. I am not anti-medicine. I'm pro options. I'm pro patient. I believe in building a bridge between these more holistic modalities and seeing the best of both worlds really come together, integrating where it makes sense. Because let's face it, your health isn't black and white. It's not either or, it's both and. So, what can you start doing now? You know, if you're feeling like you're stuck in this sick of sick care loop, one thing that you can start doing is to start to track your symptoms, journal them, make notes. You're the expert of your body. You know how you feel. But here's the thing, we've become so disconnected from the body that we live in. It's crazy to think. We end up feeling a certain way, be it exhausted, bloated, frequent headaches, aches and pains, that we end up accepting it as our norm. It becomes just the way things are. I know, I've been there. Complacent, numb even. So I invite you to get to know your body. Record what it feels like, your symptoms, the time of day, after a meal, and then take it to the next level. Decide how you want to feel instead. What does that feel like? What does that look like? Close your eyes, deep breathe, do whatever it takes to get you connected to your body. Just sit for 5 minutes. It's so hard to just take 5 minutes, isn't it? The next thing you may want to do is just to really get curious. If something feels off, don't gaslight yourself into ignoring it. And furthermore, don't allow anyone else to do it either. Every body is unique. What works for some is not going to always work for others. So be careful of who you're taking some advice from. And find practitioners who will look deeper. That could mean changing your medical doctor. It can be consulting with a functional nurse. Hey, that's me. Or an integrative doctor, or a naturopath, or a holistic nutritionist. Take it to the next level. And aside from that, you likely need to make some changes. Okay. I hate to be the bearer of bad news, but look, it took you years to get here and feeling the way that you do. And I'm here to tell you that there's no quick fix. The current healthcare model has us expecting and wanting a quick fix. Take up this pill, help you feel better. That make me feel better now kind of treatment. That's symptom management. And yes, we can accept that symptom control. Okay. We want to feel better, but also Let's fix the underlying issues, which can take some time. It's going to require making some changes on your part because you've tried this and you've tried that and it hasn't worked long term. It's just not working. So, starting with simple shifts and foundational habits can really make a huge impact. Small hinges swing big doors, and any progress is progress. Food, sleep, stress, movement, these are all pillars in your foundation. So, it's a good place to start. Take that inventory there. I'll talk a lot about these in upcoming episodes because they matter more than you think. And lastly, know you're not crazy and you're definitely not alone. The trial and error method of prescription medication, symptom management, and band aid medicine has got people sicker than ever. There's a lot of people out there sick and tired of feeling sick and tired. And it may sound cliche, but it's true. And they're getting younger and younger too. It's wild. You deserve more than that 7 minutes that a provider is allowed to have with you and these generic solutions. It's time to look outside the box. And again, it's not always the doctor's fault. I really want to make that clear. I'm not here to bash many that I know want to make a difference for their patients. They really do. Some may not, but many do. But, they don't have the opportunity to do so because the way the system works. You deserve to be heard, you deserve to be understood and empowered. So if you're sitting there thinking, yes, I am sick of sick care, this totally resonates with me, then you're in the right place. This podcast is going to be your no BS guide to wellness redefined. We'll cover topics that reframe the way you think of your health and wellness and bring on guests that are supporting people in an out-of-box kind of way. And I can't wait for it. I'm excited to have you here with me. So if you found this episode helpful and are excited as I am to embark on this journey, please do me a favor, hit that follow button so you never miss an episode, okay? And feel free to send me a question or, give me some ideas on content that you're interested in learning more about. I would love to hear it. You can email me at tess@nurturingrootshealing.com. And thanks for being here. And thanks for being willing to think differently and outside the box. You don't have to settle for fine. Let's build something better. This is Sick of Sick Care, the Wellness Reframe. See you next time.